Sure. For those that are new to the show, and those, of course, that have been following the show for a long time, we do something every week called Myths versus Facts, setting the record straight. So here we go. Myths versus Facts. That Testosterone Show. So what I'm going to do is I'm going to say a statement, and I'm going to have my panelists say myth or fact. We're going to kind of keep it kind of boom, 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 keep this going on. And there are right answers. There are opinions, of course. But again, we want you at the end of the day, even though we're going to do this, I want you at the end of the day to talk to your doc. You know, you're hearing some stuff from us, but talk to your doc. So here we go. Myth or fact? Dr. Kiriluk, you get the first statement. I'll say the statement, you say myth or fact, and tell us why in a few sentences. Here we go. If your doctor diagnoses you with obesity, metabolic syndrome, or diabetes, then the root cause is low testosterone.
I would have to go myth with that one, and I would say it's actually the exact opposite, that more likely your diabetes is the cause of low testosterone. We know that if you're overweight, if you have extra fatty tissue, the fat actually creates estrogen, and then the estrogen blocks testosterone from being produced in the body.
Excellent, I agree. Here we go, next one. Here we go, Dr. Lee, here's a statement. Low testosterone is undertreated and underdiagnosed. Myth or fact?
Can I say depends?
Yes, you can. Hey, it's your opinion.
Depends.
It's a show, but it's your opinion.
I think the study did show that in the last decade, actually, there's more awareness. But lately, there's it may be that some articles say that there's a concern of actually underdiagnosed because now there's the media. Not media, I should say. Actually, there's some reports say that there may be a negative effect on the cardiac health. So sometimes it kind of like draw us, the provider, to offer the patient, so it may be undiagnosed sometimes.
Yeah, I would agree. As an internist, we want to keep people treated, and certainly some of the studies that have been out there associating low testosterone with a whole host of increased risk for other metabolic issues or physical diagnoses. So I agree with you. All right, here's a statement, Dr. Kiriluk. Low testosterone is a normal part of aging.
We don't know, I would say. I mean, it's something that, again, we don't know normal levels across age ranges. And, I think that many men will have levels that stay normal as they age, but we do expect some decrease over time, and whether you say that's normal, I don't know, but yeah.
I agree. Wonderful. Here we go. Dr. Lee, here's a statement. Low testosterone can be linked to mood swings, fatigue, low energy, and a lack of drive to get up and do things. Myth or fact?
I think it's a fact, but also other condition can cause those symptoms too.
All right, thank you. Here we go, Dr. Kiriluk. Here's a statement. There are no harms in taking over-the-counter supplemental testosterone formulations. Myth or fact?
I would say that's an absolute myth.
Well,
the best example I can give, and it's not necessarily for testosterone, but people all the time are into supplements, and it's I want to take a supplement rather than a prescription, and they're both pills, right? Why would you? But vitamin E, right? You look at vitamin E, and so many people that take that, and studies that show excess vitamin E causes heart disease. And so a lot of times we're putting things in our body that haven't been thoroughly looked at, and who knows what's in the supplement that you're getting. And there may be risks that we're completely unaware of with it.
There's like a nice comic book strip, and I might be butchering it a little bit, but there's two lines. There's like two stands, and there's like a receptionist or somebody in a stand, and there's two lines, and the one line says drugs and pills, and it's got a full line of people and surgeries, and then the line that says lifestyle changes, and there's 0 people in that line. And so it's so true. All right, here we go. Dr. Lee, we'll do a couple more of these things. This is awesome. Here we go. Some active steps to prevent erectile dysfunction include exercising regularly, keeping a healthy weight, avoiding smoking or vaping, and taking care of other problems, including diabetes, heart disease, and kidney disease. Myth or fact?
Yeah, absolutely it's fact. Yeah.
Please explain.
Because we talk about hypogonadism, low testosterone. Some of them is functional, secondary to some chronic condition. So in those patients, if they can losing weight, they can get more sleep. Those actually will help the those help the testosterone level and the function more than the replacement.
All right, here we go. Dr. Kiriluk, I think we answered this question already, but I'm saying it again. Here we go. Every adult male should know their testosterone levels. I hear on the commercials all the time. Myth or fact?
I think every adult male should know their cholesterol levels and their blood pressure levels.
Excellent.
And not their testosterone.
I like that.
levels,
Yeah, I like that, and it's good. As an internist, that makes me feel nice and warm and fuzzy. Knowing that my specialty colleagues say that kind of stuff. Yeah, I have no idea what mine is. I actually do for my labs. I actually did have my physical done, everybody. I just got to go get my labs done. It's happening very soon, I promise. I think. All right, here we go. A couple more of these things. Here we go, Dr. Lee. Testosterone replacement therapy may or may not improve erectile dysfunction. Myth or fact?
It's a fact. Yeah, I mean, for your erectile dysfunction, many things may play a role to it, like the blood flow, nerve problem, or psychological or hormonal. So if it's related to the hormonal, then the testosterone replacement, may help it.
All right, thank you. Here we go. Dr. Kiriluk, we'll do two more of these. One for Dr. Kiriluk and one for Dr. Lee. Here we go. Dr. Kiriluk, testosterone replacement therapy will cause prostate cancer. Myth or fact?
That's a myth, although maybe a little controversial, but I truly feel that testosterone is not the cause of cancer. I would describe it as the fuel that can feed cancer cells. And so, the question from a prostate cancer standpoint is, well, how much do they need to be activated? And, even if you have a little bit there, we find that cancer cells can be activated in patients in prostate cancer in advanced states.
All right, thank you. Here's the last one, myths versus facts. I'm saying this one for Dr. Lee. I thought of you when I wrote this one on purpose. Here we go. Testosterone excess will cause road rage, fighting among fathers at Little League games, and sexual promiscuity. Myth or fact?
I think road rage and fighting among fathers may play a role, but most of it is that's a component of the culture, society and stuff,
Yeah, I think there's other issues at play on this one, but I would say testosterone excess should not cause fights to break out at Little League soccer games or baseball games. So there you have it, everybody. Myth versus fact. So hey, we got about 5 minutes left.